Well, good morning, everyone. As you've seen, we have a lot of great programs that help us to promote the dairy industry on your behalf. We've seen a lot of tangible results. We've seen a lot of videos, great photos of people enjoying our product. The other part of Dairy Checkoff is the protection aspect of it. And there is a lot of work that goes on behind the scenes, not only within Dairy Checkoff, but within the dairy community, from our cooperatives to our processors to our national partners as well. And so today, I'm honored to be on the stage with a panel who have been working tirelessly over the last 12 months to really pull that into place through H5N1. We're coming up on a year, and I wanted to share with you the work that we're doing on behalf of Michigan's dairy community. So if each of you would take a moment to introduce yourself and your organization and your role, that would be great.
Sure. Thanks, Jolene. I'm Caroline Krajewski. Hi, really nice to be here. I oversee corporate relations for DMI. So for us, corporate relations includes 3 areas of work. It includes our corporate communications and our work to demonstrate the U.S. dairy sector's leadership. It also includes our internal communications work and the work that we do to rally and engage the broader dairy community in our reputation building efforts. And then what we're here to talk about today, crisis and issues. Thanks for having me.
I'm Michaela Hanselman. I'm the Director of Regulatory Affairs at the National Milk Producers Federation. For those unfamiliar with National Milk, we represent dairy cooperatives on federal policy and regulatory issues. So we're based in Washington, D.C., working in that fun environment right now. I also lead our Farm Biosecurity pillar, which is a part of the National Dairy Farm Program, and I'll touch on some of the resources we have available through that later.
Good morning. I'm also pleased to be here, and I'm Nora Wineland, state veterinarian, so I'm with the Michigan Department of Agriculture and Rural Development, and my role is to work with industry and help with keeping animals healthy and our food supply protected.
Well, good morning, and I'm Doug Chapin. I serve as the chairman for Michigan Milk Producers. I also dairy with my wife and son in Mecosta County. We milk about 1,000 cows, so I'm just here today as a dairy producer.
Great, thank you again for joining us today. I do want to take a minute to level set us on everything that's happened in the last year. When we look at this timeline, there's been a lot. In February of last year, we were starting to hear rumblings that there were sick cows in Texas. It was something that we hadn't seen before. Tests were being done, and those farmers were working through that. Fast forward to March 25th, it was a Monday, and USDA announced that high-path avian influenza had been detected in Texas herds. Fast forward to March 29th, just that Friday, it was confirmed that a herd in Michigan had tested positive. We knew that at some point we would be facing that, but as I told Melissa when I talked to her that morning, I didn't want us to be one of the first. Wanted to see how others were responding, but we dove into it. Made a lot of phone calls. I think Caroline was my second call to say, what's going on? What are we doing here? And then our team got into place pretty quickly, pulling together a lot of these folks, and we'll talk more about that in a few minutes. Fast forward to the very beginning of May, and the Michigan Rural and Ag Department, they put together some biosecurity guidelines that were sent out to all dairy farmers to help stop the spread of this virus. Throughout the summer and the spring and leading into the summer, there were a lot of questions about what would county fairs look like. A lot of you in the room have kids and grandkids who are getting ready to show at their county fairs and even the state shows that we have in Michigan. And because of the work that we had done, there was an allotment of allowing dairy heifers to be shown at those county fairs. In July, the USDA came out with bulk milk testing. They wanted to get a hold of the prevalence of this, and this was a voluntary program that dairy farmers across the country could sign up for to say, We want to know, we want to be part of it, we want to help learn more about this. And then fast forward to the end of October, USDA said, okay, states, we need to have each one of you step up and do testing. Throughout that, before that, I will jump back in and say that this group was talking very regularly about what would that look like in Michigan, and had gone through a lot of scenarios, bringing in the cooperatives that are represented in our industry as well. So we were prepared for this conversation and for this enactment. And then December 1st, that's when our surveillance testing started here in the state of Michigan. And I know Dr. Wineland will share more about that as well as we go through. So with that, I'd love for each one of you to take a minute and talk about the roles that your organizations played during H5N1.
Sure, I can start. Thanks, Jolene. And I was going to take the opportunity to talk a little bit about the DCMT. For those of you who aren't familiar with the DCMT, it stands for a Dairy Communications Management Team. We're really lucky that all of you in the room and farmers across the country continue to invest in the DCMT. It includes representation across the dairy value chain. Local, national, international, NMPF, IDFA, co-ops, processors. It brings everybody around the same table with an objective of going to market with a unified voice during times of uncertainty, during times of crisis. And I think that's really important, and it has been really important in terms of H5N1. Because it doesn't necessarily mean that we're all always saying the same thing all the time. We all know that across a very broad and diverse dairy value chain, that is not possible. But it does mean that we are all singing from the same song sheet all the time. And I think you saw that hopefully come to life during H5N1, especially when there was a lot of education that needed to happen. But when I think about the very early days of H5N1 and February, maybe even January, a lot of the work of the DCMT was simply investigation. What do we know? Where are we vulnerable as an industry? Where are our farmers and their animals vulnerable? Where might consumer confidence be vulnerable? I very keenly remember a phone call I got. It might have been January, it might have been February, from one of our farmer relations leads, Stan, before we knew anything about what was going on. He said, I think there's winter dysentery. So I'm taking a master class on winter dysentery. How can I get as smart as I can get on winter dysentery as one key part of the broader DCMT? And then, of course, that changed 30 different times before USDA confirmed it in March as bird flu. But that's also part of the beauty of the DCMT, that you have all of these connections. NMPF, I know Michaela will talk about this, IDFA and others have a real strong line to FDA, USDA, CDC, and we were able to collect facts, deliver those facts, and then prepare for when this reached critical mass.
I can go next. So as Carolyn kind of led me into, we work very closely with the agencies. So as soon as we started to hear those rumors of winter dysentery in Texas, we started calling people at USDA and we were like, what's going on? And so it was actually on my birthday that I found out that it was high path. That was fun. And so basically we just started communicating as much as we could with USDA to hear what they were doing, what they knew, and what they needed from us. A great example of this was when they first put that first federal order in place on movement. There was issues with moving cows to slaughter because, no offense to USDA, they didn't think about that not every state has a cull cow plant. And so we had conversations with them about, you need to tweak this a little bit to serve the dairy industry better. So we really just tried to be that conduit between representing the dairy industry and talking with the agencies. But we also worked with a lot of groups such as NASAHO, which are the state animal health officials, NADRO, which represents the dairy regulators, to make sure we were all on the same page, carrying that same message forward and working for the best possible outcome for the dairy industry, because this was the first time the dairy industry has ever experienced high path. And so we're all kind of learning everything at the same time every day.
You know, I think my role from Michigan Milk's perspective is really two focuses. Number one, make sure as we went through a lot of things we didn't know about, that it was manageable for our producers. Let's make sure our producers had the tools, the knowledge, and the understanding of the regulations they needed to move forward. And then number two, obviously make sure that our customers felt secure in the safety of the milk, and make sure that we were honest and transparent with them about the safety of the product that we were delivering and the safety of the product as it was in the stores.
So as Michaela has already mentioned, as state veterinarians, we're having a lot of conversations early on to try to understand, was it winter dysentery, was it something else, and then the announcement was made. And after that, we really didn't know any more other than we had a name for it. So there was a lot of unknowns to really talk through, to share what we knew, to share what we didn't know, to share what we were doing to try to fill those gaps of things that we didn't know that we needed to know. And really here in Michigan, it was constant communication. Like's been mentioned, it took us a little while to get going because we hadn't ever had this sort of thing nationally or in the state. So getting together to be able to get on phone calls, understand each other's concerns and how to move together forward under all these unknowns. So really it was developing that communication, and I'm so appreciative to Jolene for pulling us together and helping us make sure we had space every week to be talking and sharing what we know.
Can I just add one more thing? I totally forgot to mention the FDA side of this. So when we first found high path, obviously we didn't know the pasteurization was effective in killing it in milk or reducing the viral load, if we want to get scientific. And so that was part of the early conversations we had with FDA. Is we were like, you need to get going, you need to get a study done to prove this works. And we need talking points for customers and consumers about how our milk supply is still safe for them.
And that study and those talking points came out very quickly that we could all use. Go ahead.
Yeah, and I would add, we were also talking with veterinarians. We made the disease reportable so we could know where it was, and we needed to talk to veterinarians and let them know what we did and didn't know. So there were communications needed in all directions.
And one of the most important communications was out to dairy farmers to make sure you knew of the information that was available, to make sure you had resources. So Michaela, do you want to talk about what NMPF was doing and providing?
Yeah, so not only were we communicating with agencies, we were also trying to communicate with our dairy farmer members. So I would say within, I want to say 2 weeks of the outbreak being named, we tried to pull together a webinar for dairy farmers that had huge participation, which included a vet who had been on a farm in Texas and had real life experience with this, and USDA to really talk through what was going on and just try to get information out there so that when people heard rumors, the rumor mill didn't get started. And so from then on, every time something new changed with the outbreak, we found something out. USDA put something out. We tried to hold another webinar, and anytime farmers came forward with questions, we tried to add that to our website to just really put as much information out as possible. You'll see up on the screen, one of the early questions we received is, what can I do to prevent this from getting on my dairy farm? How do I stop the spread? And so we quickly looked at the Secure Milk Supply Plan, and for those that aren't familiar with that, that's the plan that was developed for the dairy industry to hopefully ensure continuity of business should there ever be a foot and mouth disease outbreak in the United States. So we looked at that and we compared it to what we knew of H5N1, and we pulled some of the key pieces out of that to provide a resource for dairy farmers. And then we also put together an H5N1 technical committee that brought together states, veterinarians, USDA, FDA, academics, dairy producers, and processors to look at what other resources were needed. And on the last slide, sorry, you're good. You see that early detection. That was from research that came out of Iowa State, and we put that together for dairy farmers to hopefully encourage testing, because if dairy farmers were testing, they might be able to find H5N1 in their bulk tank sooner. It shows up around 2 weeks ahead of clinical symptoms. and then they could prep better for those symptoms in the dairy cattle. Next, I'll show you our Farm Biosecurity Enhanced Resources. We launched Farm Biosecurity actually in 2021, and if I'm being brutally honest, no one really cared about biosecurity until this outbreak. But I was very thankful that we had put these resources together for dairy farmers, and it just kind of worked out in timing to have these log sheets. I know that was a big part of Michigan's push, is just keeping track of what's going on and off your farm, people and animals. And then if you go to the next slide, just signage for being aware of what's a biosecurity area, cleaning things, and just really providing as many resources as we could for dairy farmers.
And we appreciate NMPF pulling that stuff together, because when we got the news that there were going to be biosecurity guidelines coming from the state, we wanted to make sure that our farmers had those resources. So we put together biosecurity toolkits using a lot of your resources of the signs, of the logbooks, and sent those out to almost 200 farms. We still have them available if you're interested in sharing those at your farm location. So Caroline, switching track and talking about consumers, they play such an important role in our industry. They're the ones who buy the food and enjoy the food that we produce on our farms. Can you talk about consumer perception throughout H5N1?
Yeah, thanks. And it was such an important part of this. And as you all know, and you've heard from everybody on this panel, there were so many important groups of stakeholders that we were trying to reach and engage with. And consumer confidence and building and or maintaining consumer confidence was one of them, and really important. And early days, March, April, we were noticing a couple of things. Number one, we were observing, while the dairy community, local, national, in partnership, were doing a really good job of speaking with a unified voice and a clear voice, some of the reporting was just confusing. Some of it was a little alarmist, some of it was speculative, and so we kind of wondered where consumers' heads were at. If we were confused, we thought, well, maybe they're confused too. And then the second part of that was, and Michaela touched on this, we knew pasteurization worked, but we kind of wondered what consumers were thinking too. So you see this up here on the slide. We have pulsed consumer perception 5 times over the last year. This last one was done just last month to get a sense for where their heads are at. And I'll touch on a couple of things here. The first being awareness. So our number one, I shouldn't say our number one objective, but one of the most really important things that we wanted to do here was not make people aware or concerned if they weren't already. We didn't want to break into jail on this, but we did want to know how many consumers were actually aware that this was happening, again, especially in early days. You see here sort of a loose average of about 20% awareness. That's really low. I mean, when you think about how prominent this has been for a year in the media, only 20% of consumers are aware that dairy is experiencing bird flu and dealing with bird flu, we were very surprised by it. The other thing I'll say about awareness is you see these numbers have gone up and down and back up. It doesn't mean that people were aware and then they became unaware and then they became aware again. It really just is a gauge of how top of mind the issue has been. And so it's not real surprising that it is more top of mind in February last month than it has been sort of over the summer. And I think dairy, unfortunately, is just getting lumped into a lot of the conversation that's happening right now about poultry operations and egg prices and egg shortages. We also asked consumers about concern. The question we asked them about concern was really focused on how concerned are you that about human infection, about you or your family becoming infected. Because if you remember back in April, there was a lot, even more speculation than there is now. This is the next COVID-19. This is the next pandemic. This is how you can protect yourself. So we wanted to see how that was resonating with consumers, and they're concerned. And we see here in Pulse 5 that they're more concerned than they were before. And that is really helping inform how we, as a dairy communications management team, again, locally and nationally, are communicating with consumers to try to alleviate some of that concern. The other one I want to touch on before I turn this back over to Jolene is trust, because we wanted to understand consumers' thoughts on, do you trust that the milk supply is safe? And that April, May, June timing was when a lot of the studies that Michaela mentioned were being publicized. And they were being publicized that inactive viral particles were found in retail samples of dairy foods off the shelves in various areas across the country. Inactive is right there in the terminology, but it scared consumers, and we knew it was scaring consumers, and so we wanted to know how much trust they still had that the milk supply is safe. These weren't necessarily the numbers that we wanted to see. We wanted to see higher numbers, but what I will tell you, which is important here, is that let's take February 2025, for example. We have 41% of consumers saying they trust the milk supply is safe. The vast majority of that complementary percentage, the rest to get us to 100, is not, no, it's not safe. It's, I don't know, I'm not sure. I'm seeing a lot in the news and I'm just not sure. That gives us some really good intel in terms of how we can continue to reinforce the effectiveness of pasteurization through our communications, through third parties and others, again, to really alleviate that concern. And then I will say, I do have some slides, but we don't need to show them. You all know this. Nationally, as well as locally here in Michigan and other regions that have been impacted by H5N1, there has been zero discernible effect on retail sales. And so I think while these surveys are really helpful and they help us really understand how to talk to consumers in a way that resonates with where their head is at, you also take it with a grain of salt, because sometimes consumers say one thing and do another.
Thank you for sharing that. Dr. Weinland, I'm going to turn to you now, and I know we've had a lot of conversations over the past year, and you really talk about focusing on the science. And early on, we talked, and you even mentioned it last week when we chatted too, that early on there were states that were doing major quarantines, or they were limiting, cattle from coming in. Can you talk to us about why you didn't do that and what science meant to you?
So, like I mentioned, we didn't know where it was. We didn't know how to get ahead of it. So what we did could really be an impediment to reporting. And as other states quarantined or restricted movements, that really had an impact on the dairy industry and would have an impact on people being willing to report. I think the other thing, quarantine is a big tool that we have to address disease movement, right? It stops movement of animals that might spread the disease. But early on, I think we knew animals had moved it to Michigan. They were healthy when they came, but we really didn't know any other facts that we could use to apply, like how would we quarantine, what classes of cattle, how do we know when it's time to release the quarantine, that it's safe for them to move again. What we really needed in those early days was science, a willingness for people to step up and report. That's one reason why the state made grants available to those herds that were affected to help them with the costs that this disease was creating for them, and allow us to get Michigan State University and others in to help understand the epidemiology and spread of the disease, so that any actions we take would be helpful as opposed to hurtful to the industry and not help us get ahead of the disease.
Thank you. Doug, I'm going to turn to you now, and you mentioned you're here as a dairy farmer representing your peers in the room and across the state. Can you talk about that role that you played in those meetings that we had with Dr. Weinland and her team, as well as with other commodities as well? And how did you convey the needs of dairy farmers and then share that back out?
Okay, so, if you go back to, let's say, March, April, right when it happened, it was all unknowns, right? And so I think the first the first interaction of this group and other co-ops, DFA definitely played a very active role, and of the dairy group that got together was to just a role of understanding, right? But everybody that was on those initial calls, I think everybody was reacting with a piece of fear, right? I'd say even the state a little bit, right? Because there was a lot more unknown than known. And right at the same time that we had our initial hit, poultry had an initial hit that was very significant. So at the same time, we're trying to weigh the dairy issue, poultry is weighing their issue. I'd love to say it was a kumbaya group all the time. It probably wasn't. The poultry got hit hard early, very different diseases and like that. And so there was a lot of noise, few facts, and a lot of fear in the drive to overreact, I think. And so I really think the role as a dairy producer that I got an opportunity to play was to really talk about, okay, that is not doable, or are you sure that'll be effective? Is that discussion on movement going to serve what you want to do? Do you understand how cattle move in the dairy industry today? It's different than it was 20 years ago. So to offer a lot of those insights that other people in the room, yeah, they knew dairy, they knew milk. They probably didn't know how the cattle actually move in our industry today, especially through large farms and heifer raising and some of those challenges. So I had an opportunity to talk about that. Also had an opportunity to talk about the importance of reporting because we didn't know, and the discussion, how do we get farmers to report and like that. And I do believe this group and our interactions with Director Boring really drove I think Michigan actually drove the existence of the ELAP payment. We played an important role in it, I can definitely say that. I saw Director Boring ask Secretary Vilsack, we need some help. We want guys to step up. We need the science. There's programs for poultry. There's not really any programs for dairy. And I think this group did help the discussion that helped drive that. And I do appreciate Director Boring getting ELAP payments out there for producers to definitely to settle milk loss. Let's see, and as we went through the reporting issues, as we went through all the issues, one of the things that I will compliment the state on is that they did keep the milk moving. Our milk moved every day, the market stayed open, there was no threat to that. They understood that. They had no intention of putting a threat to that. But that's where the fear piece came in, and there was definitely fear on the countryside that was pretty hard to alleviate that wasn't part of the goal out there. Let's see. I need notes because I'll forget things, but I would like to add that it became very clear when poultry was in the room and the importance of being a good neighbor to poultry, is real. I think what poultry is facing now, the D11 seems to be a little disconnected from the avian flu that hit the dairy, so maybe it's in a little better place today. But as we went through and the facts came in, it became clear that it was good that we didn't overreact too early. Poultry and dairy are in a very good relationship, working together on same goals today. The first month, we were definitely a bastard child. I mean, with poultry and like that, and those meetings were not fun. But I do think this group definitely got to play a role in mitigating the noise and staying on the facts and making the actions effective and doable. And I know there's no one that lost a market in here from the avian flu. So. Thank you.
Doug mentioned our meetings with poultry. We continue to have those every other week, and there was a group of us that just met with them yesterday. And Doug, to your point, the tone of those meetings has definitely shifted to productive conversations. And yesterday, when we gave them an update on the milk surveillance testing that's being done here in Michigan and the results of that, they were very pleased with those results. So having those conversations, open conversations, having those relationships definitely does help during the time of a crisis. It helps to reassure everybody in the room that we're all working towards the same thing. We don't want this in dairy, just like they don't want this in poultry, and we don't want that for them either. Dr. Wineland, Doug mentioned the D1.1 strain of the virus, and I know that there were a couple of herds in Arizona and Nevada recently that were impacted with that. Is there anything that you can share about that?
I guess what I can share is the journey with this virus is not over yet. It does appear that those were separate spillover. I think we heard all along with the B3.13, which is the version of the virus that we faced in the dairy industry and the poultry industry a year ago. Now there's the D1.1. This is not unusual in the poultry experience, but we thought it was a single spillover, we wouldn't see it again. It's still a very rare, or we would be seeing more because there's a lot of different strains out there. But this virus is out there in the migratory wild bird populations, and I think we're still learning. And I think one of the things that has come out of this that, it's good to see a silver lining in some of these crises. So a recognition of the need for working together, an understanding of the industry that I will admit freely to this group, I had no idea how many lactating cattle move around this country as a just normal practice within the dairy industry. And learning that and the things that need to happen to allow the industry to be healthy is really important as we work to keep animal health at a high level and businesses, continuity of business in place. So I think we're better prepared. Unfortunately, I wish I could say we were done.
There's still a lot to move forward on. Caroline, media calls. They call every day, but when there's an issue or a crisis, those calls are expedited. For Michigan, I mentioned that our confirmation came on Friday, March 29th. It was also Good Friday. And it was when half of our state was on spring break and the other half were getting ready for spring break. So I've said very jokingly that we kind of lucked out that first weekend because people were, a little distracted to get away to the sunshine, probably to Florida. So can you talk about the role that DMI plays in helping us to monitor media and to manage those conversations and requests?
Yeah, absolutely. And I would echo that. The media coverage and attention has been significant. But I like to go out on a little bit of a limb. Some of you in this room may have heard me say this before. I actually think that it was a good thing because it means that reporters want to get it right. And think about how much of the bird flu situation and how bird flu impacted dairy farming, dairy cattle, dairy operations that we didn't even know at the beginning. And a journalist who, given the state of media today, may have never reported on agriculture or dairy before is thrown into this. And so the Dairy Communications Management Team, DMI, in partnership with the state and regional organizations and all others across the value chain, had this massive job ahead of us, as all of you did, to inform and educate. And we're still doing that today, and you're hearing that from the folks on the panel. And so I think that was really important. One of the things that we did right at the beginning was sort of assign roles and responsibilities from a media perspective. So whether it was a regional inquiry that, we had master messages, but regional inquiries handled regionally. Our chief science officer at NMPF really handled a lot of the scientific and animal health type questions and interviews and education, others that happened in terms of how this is impacting farms and farmers and farm operations. And so we created some lanes that helped us manage the constant calls and attention from media, which, again, I think we've all experienced some highs and lows as it has related to bird flu over the last year. I think we will continue. I think one of the things that this industry and its partnership across the board achieved was minimal misinformation. And in today's day and age, that is just unbelievable. And so there's always a little misinformation, but for the most part, we kept it at bay, and that at least, even though we've still got consumers who are concerned, we at least know that they're reading the facts. And that has been one of our key jobs to be done with media, and will continue as we go along.
Thank you. We're going to start to wrap up, but as we do, I want you to be thinking of any questions that you have. So for each of the panelists, as we wrap up, what is ahead for your organization as we still continue dealing with H5N1?
I can start. We're continuing to play that investigator role, right? We want to continue to know and understand what's coming around the corner. We're leveraging some AI-driven monitoring tools that are helping us be a little bit more predictive, and trying to see how that can help us stay ahead, not only from an information sharing standpoint within the dairy community, but also to continue to build up this consumer confidence and make sure at the end of the day that they feel confident in our industry, how our industry is handling this issue, biosecurity measures, and that the dairy foods that they're purchasing off the retail shelf are safe.
Yeah, so NMPF has a couple projects going that will play right into this. So the first one is we brought together a group of farmers, academics, processors to look at the secure milk supply plan, which I had referenced earlier, and think about if H5N1 and preparing for other foreign animal diseases needs to be brought into that plan, because right now it's just focused on preventing foot and mouth disease. And then just also looking at the plan as a whole to decide what resources need to be updated and what needs to be changed so that it can best serve the dairy industry at this point in time. We also received additional funding to expand our farm biosecurity pillars, so we're expanding our training. For those familiar with the farm program, we're training farm evaluators to be able to help farmers put together enhanced biosecurity plans. And we developed a database to house those plans to make farmers' lives easier, but also so it's easier to communicate with states to get those plans approved. And then lastly, we have another project starting in a few months that's going to look at, again, foot and mouth disease, but the bulk tank tests that exist for foot and mouth disease, because one of the big issues at the beginning of H5N1 is it was really hard to put together a testing plan that fit the dairy industry's needs. So we're hoping that by looking at the bulk tank test ahead of time, and hopefully we never have to deal with a foot and mouth disease outbreak, but we already have a plan that we can put in place.
Well, I think from my perspective, what's next or how do we prepare for the future? I think we've laid a pretty good base here. I will say I don't think there's any other commodity in the livestock industry that could take this challenge any better than the dairy industry did. And it's our relationship with UDIM, our investments in UDIM and DMI. It's our memberships in National Milk and the expertise that we've invested in there that gives us what we need to deal with a lot of these issues. And then really it's our relationship with the state and the willingness to be in those discussions, to have frank discussions, to really talk about shared goals. And because that's really what it was. Everyone in the room had shared goals. How do we get to where we want to be? So I think as far as from my perspective, how do we prepare? We've kind of laid the base work, and it's really our investments in National Milk, UDIM, and DMI that really helped. When they talk about one message, there was lots of reach out to producers from press that just wanted to make noise. We didn't give them that noise. We spoke with a unified voice. We spoke about milk safety. We spoke about the value of our industry. I do believe we were our own best advocates in this. So.
So I think from the state perspective, what Michaela said is really important. Some of the preparedness for the future, I mean, this was sort of a dry run on the secure milk supply. How workable is it? What can we do to make it better is really, I'm heartened to see that. In terms of the H5N1, what's next? And while I said the D1.1, that's thrown us for a new loop, right? Because we thought we had a single spillover and maybe we could declare freedom. That's still a goal because we really think the spillover events are rare. So that's why in partnership with USDA, states are working to achieve freedom and are doing the testing. And like Doug pointed out, every state's different in terms of how milk flows. Are you a net importer of milk to processors or an exporter, somewhere in between? And then given that, how would you do testing at the bulk or silo level to understand what's going on in a region or on the farm? So we are engaged in that in Michigan at the bulk tank. Some states are doing it at the silo and then having to do tracebacks if they find any non-negatives. And so we've just finished 3 months of that and are so appreciative of the support that we got from the industry to work with the milk testing labs to be able to get samples in a pretty unobtrusive manner. There's samples that were already flowing. In December was sort of our startup month, and we had around 800 some samples. January, I think we were around 1,100. We're in the process of figuring out, well, who did we miss? And so hopefully we improved those numbers and covered all the farms in February, but we don't quite have those numbers in yet. And the good news is, even though we had that spillover in the other part of the country, we're not seeing evidence that we have that here. We found a recovering herd, which means that they were positive at NMDSL, but not evidence of clinical disease or anything to be concerned about. They have since cleared, and all of our other detections have been recovered herds, which means not very much virus is detectable, and there's evidence that the cows have responded to it and have antibodies. So I think, that's the path we're on. Like I said, every day is a new day, and progress is made and new things are learned.
Thank you for joining us today.